You're watching CT Live on NBC Connecticut.
Welcome back, everybody. Health, performance, and longevity for athletes. That is the focus of UConn Institute for Sports Medicine's work. And it's a collaboration between UConn Health and the UConn Department of Kinesiology, working together to bring nationally recognized researchers, clinicians, and physicians, rather. Let's take a closer look.
So this has been a project that I've been intimately involved with for almost 5 years now. So my co-director is Lori Devaney. We have put together an institute, and what the institute does is it allows clinical, academic, and educational departments to really coalesce together. So the institute in its inception was put together because we saw a lot of disparity in healthcare access. So I was seeing a lot of AAU athletes that either had chronic problems or just didn't have good, medical care or insurance and had limited access. So part of this was to get better access out to the community so that people had the ability to come see a specialist when they needed to. We have in our kinesiology department experts in gait mechanics, jump mechanics, things that prevent injury in young athletes. Let's get those programs into the hands of people that can best be served. And by getting that to the AAU programs, we saw significant declines in ACL injuries. So that's where it all started, and it's blossomed into educational pieces, outreach pieces, collaborative efforts with other schools and universities.
So we are inside of the Department of Kinesiology right now at UConn in one of the labs. Is this a running clinic?
Yeah, so there's a lot of things that we will measure from a kinematic output, and this is our running clinic. So this is a simple example of a person that we're looking at their gait mechanics as they're running. So we can apply some of this data to try to get people to recover from overuse injuries, or we can apply this data to help them get back to sports return, or we can just apply this data to help them become a more efficient athlete.
Can this be used for injury prevention as well?
Yeah, absolutely. In a similar way, we can put sensors on people and look at them as they absorb a jump, as they go up for a jump shot, things that are more typical of an in-play athlete. We try to use variations in imbalances that they may have, strength imbalances, landing mechanics imbalances that, once we address, reduces their rates of injury. For example, we worked with an AAU basketball team, a young girls basketball team, 12, 13 years, very common ACL injuries. So over a year we implemented this. The coaches integrated into their conditioning program. The injury rates dropped by 60% the next year.
That's huge.
Yeah, it's a pretty significant impact. So we have high schools that we partner with, we have AAU programs that we partner with, and we even have other colleges that we partner with. And it's really meant to bring it out there to the public. And in terms of the disparity in healthcare access, there's a lot of people that probably don't have access to this, that our goal is to get to AAU programs that, young patients or young athletes that we're trying to keep them on the field. Hopefully they can get to that college scholarship.
And even just looking at this right now, like an athlete might not understand why they're getting injured or what is causing them to feel certain kinds of pain, and you can literally break it down body part by body part here.
Yeah, and so the beauty of what we do here is, a lot of places can do this, but we do research in it, and it allows us to get the information to the athlete better. But athletes, as you know, they are often data-driven. They are very in tune with their bodies, and information that can get them to step A, to step B, to step C, they're very into it. And I think especially when they're recovering from injury, this helps to show them nuances. When they're struggling with a certain problem, this helps to identify things that might be small, might be not observant when the coach is just simply looking at them, that we can now highlight, and now their strength coach, their position coach, or even themselves can now work on something to get them better.
All right, so how do you actually measure these things?
Yeah, so there's a couple different ways. So this is our 2D capture system. So in this situation, the cameras will actually focus on various points or little lights on a patient. We actually have a 3D capture system where typically we use that for the throwing athlete. It's more immersive, and we're actually transitioning to a wireless system where people can actually wear it and then apply that into the field. So people could be on a basketball court or on a lacrosse field or on a baseball field, where we're actually capturing data and giving them input on how their body moves when they're doing a certain function.
And could that be in real time?
Absolutely, in real time. So the beauty is with the technology, we can look at angular velocities, we can look at speeds, and we can look at how much energy the body is absorbing as they're doing certain functions. The hope is we can figure out a way to translate that data to the athlete to tell them they've worked a little too hard, they need to take some more break, or they need to focus on this type of exercise to rebalance their musculature.
Because at the end of the day, you just want them to stay healthy and to approach their sport in the best way possible.
Even though I'm an orthopedic surgeon, I'd like to keep them out of the operating room.
Yeah. So incredible.